We're live. Just give me a minute to check, make sure that we are actually live. Okay, yes. Okay. Good morning. Welcome to today's New York City remote council hearing on the Committee on Consumer Affairs and Business Licensing.
Sergeant, I need to start the recording.
Oh, sorry.
Backup is rolling.
Computer's good.
Thank you. Cloud is rolling as well. Once again, good morning and welcome to today's New York City Council remote hearing on Consumer Affairs and Business Licensing. At this time, with all panelists, please turn on your videos. If you To minimize disruption, please place all electronic devices to vibrate or silent. Thank you. If you wish to submit testimony, you may do so at testimony@council.nyc.gov. I repeat, testimony@council.nyc.gov. Chair, we are ready to begin.
Thank you. Good morning. My name is Diana Ayala, and I am the chair of the Committee on Consumer Affairs and Business Licensing. I would like to welcome you to our remote hearing today. Before we get started, I would like to acknowledge that we have been joined by council members Menchaca, Brennan, Kul, and Yeager. Today, we will be hearing testimony on Introduction 2448 by Councilmember Gibson in relation to providing paid time to employees who accompany a child to receive a COVID-19 vaccination injection or care for a child with COVID-19 vaccine side effects. The development and efficacy of COVID-19 vaccines have been miraculous in their prevention of infections, hospitalizations, and deaths from the virus. Epidemiologists at Yale University estimated that New York City's vaccination campaign has prevented about 250,000 COVID-19 cases, 44,000 hospitalizations, and over 8,000 deaths from COVID-19 infections since the start of the vaccination campaign through July 1st, 2021. For those vaccinated, life in the city has begun to return to normal. Live theater and arts have reopened, our restaurants are operating at 100% capacity, and the vibrancy and vitality of the city has reemerged. Unlike this time last year, next week, families will gather for Thanksgiving without the fear of endangering loved ones. For those that remain unvaccinated, however, COVID-19 has continued to spread and impact their daily lives. This is especially true for children. During the early months of the pandemic, children were considered very low risk of contracting, spreading, or becoming sick with COVID-19. However, as new strains of the virus have developed and as new research has been analyzed, it is clear that children are not only carriers and spreaders of the virus, but may also fall sick due to COVID-19, even if that happens less frequently than it does for adults. Children's ability to carry and transmit the virus is concerning, as well as it has hampered the ability for the city to return to normal. In the past week, 2 schools in Queens were closed due to COVID-19 outbreaks. The closure of schools due to COVID-19 outbreaks impedes students' learning and forces parents to provide childcare on a moment's notice. Thankfully, children can now access safe and effective vaccines. The FDA issued an emergency use authorization, or EUA, for children between the ages of 12 and 15 this past May. On October 29, 2021, the FDA issued an EAU for the use of vaccines for children between the ages of 5 and 11. The vaccine safety was studied with over 3,000 children ages 5 to 11 who received the vaccine, and no serious side effects have been detected in the ongoing study. The nearly 2 million city residents under the age of 18 who can now get vaccinated will be a major boost to the city's recovery from the pandemic and will further protect those most vulnerable to serious illness from COVID-19. Nonetheless, parents accompanying their children to get a vaccine should not have to choose between the vaccination of their children or going to work and going a workday unpaid. More than 1,000 sites will open this month as schools across the city to offer vaccinations to children. However, there have already been reports of extremely long wait times. Outside Public School 40 on East 19th Street, a child reported waiting 6 hours in line to get the shot. Not every parent or guardian has the luxury of taking 6 hours out of their day to accompany their child to get the vaccine. As the mayor has said, you shouldn't have to choose between your paycheck and the health of your family. We must ensure that every city parent and guardian has the ability to get their child vaccinated. The mayor has provided the ability for all city employees and contractors to receive 4 hours of leave per child, which allows parents and caregivers to care for their children should the child experience side effects from the vaccine. This same right must be extended to private workers as well. Intro 2448, which we are hearing today, would update the Earned Safe and Sick Time Act to include requirements for employers to provide employees who are parents with paid COVID-19 child vaccination time. We will hear feedback from the administration and advocates today on this important bill. I will now turn it over to Councilmember Gibson if she's here. Is she here? She is not here. I want to recognize that we've been joined by Councilmember Kalos. So I will assume that we will then go to testimony from the admin.
Thank you, Chair. We will be turning to testimony from the admin. I'm Stephanie Jones, counsel to the Committee on Consumer Affairs and Business Licensing, and I'll be moderating. Before we begin, I'd like to remind everyone that you will be on mute until you are called on to testify, at which point you will be unmuted by the host. During the hearing, I will be calling on panelists to testify. Please listen for your name to be called. At this hearing, we will first be inviting testimony from the Department of Consumer and Worker Protection, followed by testimony from members of the public. During the hearing, if council members would like to ask a question of the administration or a specific panelist, please use the Zoom raise hand function and I will call on you in order. We will be limiting council member questions to 5 minutes, which includes the time it takes to answer your questions. For all panelists, when called on to testify, please state your name and the organization you represent, if any. We will now call representatives of the administration to testify. We will be hearing testimony from Peter Hatch, Commissioner of the Department of Consumer and Worker Protection. We will also be joined for questions by Ben Holt, Deputy Commissioner of the Office of Labor Policy and Standards at DCWP, and Stephen Atanani, Executive Director for External Affairs at DCWP. At this time, I will administer the affirmation. Administration panelists, please raise your right hands and I will call on each of you individually to respond. Do you affirm to tell the truth, the whole truth, and nothing but the truth before this committee and to respond honestly to council member questions? Commissioner Hatch.
I do.
Thank you, Commissioner. Deputy Commissioner Holt.
I do.
Thank you. Executive Director Atanani.
I do.
Thank you. At this time, I'd like to invite Commissioner Hatch to present his testimony.
Thank you, Council. Good morning, Chair Ayala and members of the Committee on Consumer Affairs and Business Licensing. I'm Peter Hatch, Commissioner of the Department of Consumer and Worker Protection, or DCWP. As mentioned, I'm joined by Ben Holt, our Deputy Commissioner for the Office of Labor Policy and Standards, and Stephen Atanani, our Executive Director for External Affairs. It's a pleasure to testify before you for the first time, and I look forward to our work together. DCWP protects consumers and workers through enforcement of consumer protection and key workplace laws. We also promote New York City's economic recovery by supporting small businesses and encouraging a culture of compliance. As a lead for the Small Business First initiative, DCWP continues to make great strides to streamline the licensing process with a focus on customer service and to increase transparency through expanded outreach and education to businesses, to ensure equitable enforcement, and to reduce the number and cost of violations. In 2020, we joined with sister agencies to promote the safe reopening of our city's businesses, and more recently have been one of the primary agencies assigned to implement Key to NYC as part of our city's ongoing recovery efforts. In 2014, when Mayor de Blasio signed Councilmember Chin's paid sick leave legislation into law, he declared that New York City was leading the nation in guaranteeing access to sick leave for employees, and that this law is about, quote, making our businesses run better and protecting the health and welfare of their customers, end quote. Our first media campaign about paid sick leave reminded employers that if their employees feel 100%, they'll work 100%. Those priorities for consumers, for workers, and our businesses remain ours at DCWP today. While some criticize the 2014 law as too burdensome for small business, evidence shows it's been a success for our city's workers at low or no cost to the vast majority of city businesses. That's why this administration has been proud to partner with the council on expansions of the law. The 2017 expansion provided crucial safe leave for our workers. And during the pandemic, further expansions provided more hours of leave and greater access, including to domestic workers, ensuring robust protections for the more than 3.6 million private sector employees in total eligible for paid safe and sick leave, PSSL. From the beginning, we knew that for this law to be effective and to empower workers, we would need to be committed to ongoing outreach and education about these rights. So since 2014, we've held more than 2,400 events on the requirements and protections of PSSL, reaching more than 120,000 New Yorkers. And when we launched our first public awareness campaign, we invested significant resources in language access and ethnic media, and we continue to do so to this day to reach our city's vibrant communities and diverse workforce. We also have been committed to ongoing outreach and education for employers about how to comply with PSSL, providing them with tools and training to make that easier. During the initial implementation of PSSL in 2014, we even instituted a 6-month penalty-free grace period to alleviate concerns about costs related to this new law. Just as we did in 2014, DCWP continues to host business roundtables and trainings. And this past year alone, we reached nearly 3,000 participants working in partnership with our city's chambers of commerce, business improvement districts, and other key business advocates. DCWP enforces paid safe and sick leave through our Office of Labor Policy and Standards. And since 2014, we've secured more than $14 million in restitution and civil penalties related to PSSL violations, which has helped more than 38,000 workers in our city. Just a few weeks ago, we announced settlements with major airlines totaling more than $235,000 in restitution for ground crew workers whose PSSL rights had been violated, including one worker who was illegally fired just for taking sick leave. Through our efforts, that worker was reinstated with their position and awarded back pay. Paid sick leave during COVID-19. So throughout this pandemic, we've seen how important sick leave is to keeping our city healthy and putting us on the road to recovery. In 2020, this administration was proud to partner with the council to expand PSSL to 56 hours for more than 1.8 million eligible private sector workers, and to provide greater coverage to more than 200,000 of our city's paid care workers, to make it easier for them to accrue and utilize this leave so that many more workers had the leave time they needed to keep themselves and their loved ones safe from COVID. At the outset of the pandemic, DCWP prioritized educating workers on their right to use PSSL for COVID-19 testing, for quarantine, recovery, and finally, to get vaccinated once the vaccines became available. DCWP developed guidance summarizing new COVID-19 related protections that were passed at the state and federal levels to provide workers with additional leave for quarantining, taking care of their children if schools closed, and to recover from any effects of COVID. To get this information to the public, we worked through our traditional outreach partners, including community-based organizations and elected officials. And we also expanded our efforts to work with the city's Department of Health and Mental Hygiene and Test and Trace Corps, so that we were providing PSSL materials at COVID-19 test sites, vaccination sites, and even in a door knocking campaign in communities most impacted by the pandemic. This spring, we continued to raise awareness about PSSL and recent amendments to the law through paid media campaigns targeting healthcare settings, and also neighborhoods where violations of the PSSL were reported. Second phase of that campaign launches this month and will run through the end of the year to coincide with flu season. During the pandemic, we also worked to help businesses understand how to safely navigate reopening after months of closures, and to remind them that their employees could use the PSSL benefits as needed for COVID-19. This education not only stressed how important this was to employers and their workers' safety, but also to keep their customers safe. In 2020, we held more than 30 business education days all across the city, visiting thousands of businesses to help them understand best practices for being safe at work. as well as informing their workers about PSSL rights. DCWP also conducted 9,000 inspections for health and safety as part of a larger interagency coordinated effort to promote compliance. At the outset of the pandemic, we adopted a fast-track enforcement process to get workers impacted by COVID-19 faster results. For example, securing pay for workers who took leave due to COVID-19 or affirming a worker's ability to take leave to care for a child whose school closed. We knew that making sure workers had access to this leave during the pandemic meant we were not just protecting them, but also, as you mentioned, Chair, their families, their coworkers, and their employers. Now, we also know vaccination is essential to protecting New Yorkers and the city's recovery. So when the mayor appointed me commissioner of this agency, I committed that DCWP would enforce our paid sick leave law to boost vaccination rates among working New Yorkers. Regarding Intro 2448, Mayor de Blasio has noted consistently that the only reason New York City is having such a strong recovery is vaccination. And for that reason, this administration had pursued policies to get as many shots in arms as possible, as fast as possible, by reducing as many barriers to access as possible. Last week, the mayor issued a personnel order granting city employees 4 hours of additional sick leave per child up to age 18 per COVID-19 vaccination. So parents or guardians have the leave they need to take their children to get vaccinated or to care for them should they experience side effects. Today, we're proud to partner with the council on Intro 2448, which would provide those same benefits to New York City's approximately 3.6 million private sector employees. This proposed expansion of PSSL comes at a time when there are approximately 700,000 children newly eligible for COVID-19 vaccine, and their parents may have little or no leave left this close to the end of the calendar year. Intro 2448 is an opportunity to reduce a significant barrier to taking your child to get vaccinated, the fear of losing a paycheck, or worse, a job. Like past amendments to the PSSL, it gives employees increased flexibility at work and cultivates a safe and productive work environment for employees and employers. I encourage this committee and the council to do what it has done many times before when presented with an opportunity to support working New Yorkers and their families by expanding this important law. Pass Intro 2448 quickly and help ensure that this city's recovery is a recovery for all of us. Thank you for this opportunity to testify today, and I look forward to any questions that you may have.
Thank you, Commissioner. Before we move on to questions, we'd like to turn it over to Councilmember Gibson, prime sponsor of Intro 2448, to provide an opening statement on her bill. Councilmember Gibson.
Thank you so much. Good morning, ladies and gentlemen. Good morning, Commissioner. Good morning, Chair Ayala, and all of my colleagues on the Consumer Affairs Committee. I'm grateful to join all of you. Apologies for the delay. I was at a school this morning, but I really wanted to take this opportunity to say thank you to our Chair, Diana Ayala, for holding this very important hearing on this very important topic. I am proud to work with Mayor Bill de Blasio at his request to introduce Intro 2448 of 2021, which would relate to amending our city's paid sick leave. As we continue as a city to fight against COVID-19, keep New Yorkers safe in our city, it's really important that we continue to encourage all New Yorkers to get vaccinated and ensure that every New Yorker is safe and getting the access to the vaccine. During the onset of this pandemic, as a legislative body, the City Council, we've acknowledged so many of our first responders and essential workers and frontline staff who were out in the trenches providing services, continuity of care in a culturally responsive and sensitive way to make sure that many New Yorkers were getting access to not just COVID-19 testing, but also the vaccine. Intro 2448, which is on today's agenda, would expand the city's Earned, Safe, and Sick Time Act by including paid leave for any employee who is a parent or legal guardian accompanying a child to receive a COVID-19 vaccination or care for a child with COVID-19 vaccine side effects. Not only is this important to keep our children and their families safe from COVID-19, but it will also ensure that no one has to choose between a paycheck and what is best for their children and their children's health. Unlike adults, children are not able to navigate the vaccine appointments alone, so they need their caregivers, they need their parents, and they need their guardians. And so this option to take time off from work in order to care for their children will really address a lot of the issues that we've been facing. We must expand New York City's Earned Safe and Sick Time Act to support all of our parents and all of our children in their overall efforts to become vaccinated without fear of losing their income. I again want to say thank you to our commissioner. Thank you, Commissioner Hatch, for your leadership. Welcome to our hearing, and I'm really looking forward to working with you. As someone who has been fully vaccinated, who is about to get the booster shot, who has small children in my own family, I want to make sure that we're doing our part. And this bill, Intro 2448, is a step forward in providing the access and opportunity that New Yorkers will need to get their children vaccinated. So let's continue to work together to keep New Yorkers safe, to provide access and opportunity for all New Yorkers by passing Intro 2448. Thank you so much again, Commissioner, to you and your team. And certainly thank you to my wonderful and amazing chair, my Bronx colleague and sister, Chair Diana Ayala. Thank you so much to the staff.
Thank you, Council Member. We will now turn it over to questions from Chair Ayala. Panelists, please stay unmuted if possible during this question and answer period. Thank you. Chair Ayala?
Yeah, so before I begin, Councilmember Gibson, did you have any questions?
Yeah, actually just one.
Okay.
Okay, thank you, Chair. Thank you for indulging me. Commissioner, could you just provide my colleagues and I with an understanding with this particular Intro 2448 on today's agenda, what measures will the department take to actually make sure that parents are informed of this new law? What sort of assistance would you like from the City Council to make sure that we can work with our providers and parents and other organizations and different leaders in our community so we can make sure that people are very much aware of what this new law will provide for themselves and their families?
Councilmember Gibson, good morning. Thank you for that. For your opening statement, your leadership in being the prime sponsor of this bill and that question. You know, speaking as both a New Yorker and a parent of now vaccine eligible children, I agree with you. It's incredibly important that we make eligible workers aware when this bill passes that they have this incremental increase in leave time. Otherwise, all of our efforts, right, will not come to what we want them to. So we feel like we've begun to communicate to parents already through the mayor's press conference last week, talking about the personnel order and this proposed legislation to extend that to all private sector workers in New York City through today's hearing with you and the committee and through sort of an acceleration of DCWP's ongoing commitment to educate workers about paid safe and sick leave law. Specifically for this extension of the law, we would want to continue partnering with community-based organizations that are trusted messengers in key communities, elected officials' offices such as yours. We would implement the use of all of our materials being translated into more than a dozen languages, the use of our staff who themselves speak so many key languages in New York. And we would also continue our expanded partnerships with our healthcare partners in the city, the Department of Health and Mental Hygiene, the Test and Trace Corps at New York City Health and Hospitals, so that we are reaching parents and families where they're looking for information about vaccine. We agree with you. This is incredibly important.
Okay, just another question. What could we say to New Yorkers who have children between the ages of 5 and 11 that have underlying health conditions? So the Bronx has some of the lowest vaccination rates. Chair Ayala and I are working extremely hard with many of our CBOs and our healthcare providers on the ground because I think, you know, there's been a resistance, there's been a little bit of hesitancy and anxiety for many parents of small children that may have underlying health conditions. So what message are we giving to those New Yorkers who have those children that may, live with asthma or may have childhood diabetes? What are we saying to them in terms of the vaccine, that we want them to get their children vaccinated because this can help with a lot of the diseases that they may be living with today? What are some of the messages around these specific New Yorkers?
Council member, I'll leave the healthcare advice, to my colleagues at the Department of Health and Health and Hospitals. The message that we're going to focus on from our agency is potential other sources of hesitation that parents may feel, that concern that taking that bit of time off to protect their children through vaccination or to care for a child who may not feel well afterwards, that they have to worry about lost wages or worse, possible termination at work. We want to remove that barrier, that form of hesitation among many things that may be on parents' minds at this moment, so they will move rapidly to get their kids vaccinated, which is the most important way we feel as a city to protect children, to protect families, including older members of our households, plus our communities. And we'll make sure that the materials we disseminate have the best public health messaging the city has to offer.
Okay, definitely. Well, I look forward to working with you and your team, as well as DOHMH and Health and Hospitals, to disseminate as much information in an accurate way, in a real creative way, meeting residents on the ground. I also talk about faith and clergy leaders. Many of our houses of worship, they can encourage their parishioners to also get their children vaccinated. I mean, I think, we have to always be creative in getting the message across, because there will always be those New Yorkers that are hesitant. But I do think a majority of our New Yorkers are excited and will take advantage of this. So I look forward to working with you and your team. And thank you again, Chair Ayala, for allowing me to ask questions before you, Madam Chair. Thank you.
Thank you, Council Member.
Thank you.
Those were really good questions, Vanessa. Thank you. So I'm assuming, but just to piggyback off of Councilmember Gibson's question, is there a partnership with the New York City Department of Education? I mean, we have parent coordinators that are really reliable sources of information for parents. Is that partnership, is it existent, or is that part of the plan?
Madam Chair, that is a great question. Just in the last few weeks, DCWP has partnered with the Department of Education to disseminate through the channels that you just described information around the child tax credit, for example. So we absolutely intend to implement using all of the department's channels direct to parents and through parent coordinators and the many staff they have that work with families that we want to be aware of this important new leave that we hope will become available when we pass this law quickly.
I appreciate that. Now, should this bill become law, which I have no reason to believe that it wouldn't, are there any type of employees in the city that would not receive paid child COVID vaccination leave?
Thank you for that question. In the interest of meeting this time-sensitive challenge quickly, that is, new cohort of children available to be vaccinated, and the possibility that many workers may be short on leave. We to work expeditiously, we set this expansion within the context of the existing PSSL law. That law covers private sector employees as defined by state law. So there may be independent contractors who wouldn't be covered by this expansion.
Okay.
However, we are always interested in working with the council to look for ways to offer protections to even greater numbers of working people in New York.
I appreciate that. Now, in terms of the 4-hour timeline, how did we arrive at 4 hours? Like, I mean, we're hearing reports of children waiting up to 6 hours to get vaccinated. Is there some flexibility there? I'm not sure how we arrived at the 4-hour timeline.
So the initial framework for this proposed legislation builds off of the mayor's personnel order announced just over a week ago. which provided an additional increment of 4 hours of leave for city employees for the same purpose, to support vaccination and care for children 5 to 17. And we felt that the increment of 4 hours was a reasonable one to lower parents' potential hesitation. Oh, I don't have enough leave to take this step to keep my children and families safe. And that it was also, would have a de minimis impact on employers.
Okay. I mean, but I'm assuming, well, I'm just wondering, is there, is somebody monitoring, right? The situation at the school system, because if we have children waiting, 6 hours, and we're not really, I don't think that we're meeting our mandate, right? And so I'm just looking to see if there's flexibility, right, in terms of, coming back and amending this if it's possible, or working with, the Department of Health to expedite the time, the wait time for vaccination at the schools. What type of coordination is happening behind the scenes?
Let me thank you for that question. Let me note first that the existing PSSL does provide leave, right, that would cover taking a child to get vaccinated. So this is an increment beyond that. So in an occasion which an individual family needs that a little bit of time, they can rely on their existing, paid sick leave. And of course, I should state that, this administration is completely committed to accelerating vaccination for every New Yorker, including newly eligible children. And I believe the mayor has spoken this week about the need to streamline vaccine access at schools. And of course, we have provided lots of vaccine access through other points of care, through the Department of Health, and also health and hospitals. If I may, Deputy Commissioner Holt, do you want to note anything additional about, leave families might access it if needed, if that 4 hour increment, didn't entirely work for them?
Thank you, Commissioner. Thank you, Chair Ayala and committee for having me today. Commissioner, I believe you covered the primary leave options very well. The only additional leave type I would note is there is a type of leave under the city's temporary schedule change law, which could afford a worker up to 2 days of unpaid leave time that can be used for the same purposes as paid safe and sick leave, including child vaccination time, as we're talking about today.
I also just want to note, Chair, that it sounds like you're hearing reports from your constituents or your colleagues' constituents about, pods or different vaccine centers that may have extended wait times. I want to connect with you offline to find out exactly where those centers are so that I can speak with my colleagues in the health department and at the Vaccine Command Center to make sure that they're aware of that. I know as the temperatures are dropping here, we certainly don't want children out waiting for several hours for this important vaccine. So let's connect offline. I do want to find out a little bit more information about extended wait times there.
Thank you, Steve.
And I think that that's particularly, true for parents with children with disabilities. Oftentimes, right, they're children with autism. They require, a parent to be there, right? They don't trust, right? They're walking into someone that they don't know, and they're not walking into their private, doctor's office, and that creates a level of anxiety. That is often, best handled by a parent being there with them. So my concern is really just like, I appreciate the legislation, but I always think about the unintended consequences, right? Are we really wrapping around, services and ensuring that, yeah, we're putting in this policy, but that we're also recognizing that there are some challenges that may even, make this difficult to kind of manage. So I appreciate that. And I think that, some of the reports that we're hearing back are primarily from school-based clinics where, we're experiencing some delays in the timeline, right, for getting children vaccinated. So the wait times are inconsistent. Some schools have no wait time and other schools are just backlogged for some reason. So any assistance with that and trying to figure that out is greatly appreciated, because not only are parents missing, time from work, but children are also missing time from school. So that's important. I have no further questions. I want to thank you. I don't know if Councilmember Yeager or Councilmember Ku have any questions, or Councilmember Menchaca, who's also here. No, then I'll turn it over to committee counsel.
Thank you, Chair. We will now turn to public testimony, seeing as there are no hands raised for questions. After public testimony, council members who have questions for this panelist should use the raise hand function in Zoom, and I will call on you after the panelist has completed their testimony. I would like to now welcome Cassandra Gomez to testify. Ms. Gomez?
Thank you to the chair and to the committee for giving me the opportunity to speak today. My name is Cassandra Gomez, and I am a staff attorney at A Better Balance. A Better Balance is a national legal advocacy organization dedicated to promoting fairness in the workplace and helping employees meet the conflicting demands of work and family. Here in New York City, we helped draft the Earned Sick Time Act and negotiated the final terms of the legislation. We are thrilled that this important piece of legislation is being considered, and we urge the committee to move forward with and pass Intro 2448. From early on in the vaccine distribution effort in the US, workers have been clear that access to paid time off to get vaccinated and recover from any side effects would make them more likely to get vaccinated. This summer, workers whose employers provided paid time off to get the vaccine or recover from any side effects were 24% more likely to have received at least one dose of the vaccine than workers whose employers provided no paid vaccine leave. And workers with lower household incomes are less likely to receive paid leave for the COVID-19 vaccine, which has resulted in much lower vaccination rates for low-income adults as compared to higher-income adults. Now that children ages 5 and up are eligible to receive the vaccine, working families in New York City will need immediate access to paid leave to help family members receive and recover from the vaccine. Our city must ensure that responsible workers do not have to lose pay in order to shield their children from the virus. Intro 2448 will undoubtedly serve the city well and increase the likelihood that New York families will get vaccinated. The legislation proposed today would add to the existing sick time law the right to take COVID-19 child vaccination time for workers to accompany children to receive the COVID-19 vaccine and recover from related side effects. Among other strengths, this COVID-19 child vaccination time is in addition to earned safe and sick time under existing law and must be paid. As detailed in our written testimony, to make this bill even stronger, we recommend amending it to give workers access to more paid time off to care for children recovering from the COVID-19 vaccine, and expanding the bill to allow workers to take time off to assist all family members, as defined in the Earned Safe and Sick Time Act, in receiving their vaccine injections and to care for family members recovering from the vaccine. As a city that was once the epicenter of the coronavirus pandemic in the US, we must do all that we can to ensure that we never again let COVID-19 cases rise to the levels of the worst peaks of the pandemic. Passing Intro 2448 will be crucial to protecting the children of New York and stopping the spread of COVID-19. We enthusiastically urge the council to ensure Intro 2448's passage.
Thank you, Cassandra. I was going to ask you 2 questions, but you kind of answered them through your testimony, so thank you so much for that. Turn it back to committee counsel to see if any of the council members have questions.
Thank you. At this time, I don't see any council members' hands raised on Zoom. If you do have questions, please raise them now. Okay, seeing no hands raised, I'll turn it back over to you, Chair, to give a closing statement. Thank you.
Well, I just want to thank Councilmember Gibson. Commissioner Hatch, welcome. This is our first hearing. Thank you so much. It's a pleasure working with you and your team. Deputy Commissioner Hull, Steve Tanani, and obviously Cassandra, thank you so much for all of your work. And to the committee staff, thank you so much for putting every effort into ensuring that families are protected during this time, and that, we're considering, all of the factors, right, that impact, workers during this pandemic. So thank you so much, and I look forward to the next hearing.